Okay, so I would like to introduce a very good friend of mine and someone who's just recently passed the ADC exam. So this is Dr. Manju. And Manju, I'll let you introduce yourself just briefly and tell us a little bit about you and what you were doing in Australia.
Sure.
Okay.
Thanks, Shahana, for giving me this opportunity. And I'm Dr. Manju. I recently passed my ADC exams, and I'm very happy that this happened. And I started this journey a couple of years back, and in 2023 I passed my part 1, and now in August 2025 I passed my part 2.
That's amazing. Congratulations.
Thank you so much.
As someone who's been through it, as you know, I know what a great feeling that is. So congratulations.
Thank you.
So why I've got Manju here with us today is just to share a little bit about her journey and also just to give a little bit of inspiration and motivation to all of you ADC candidates out there who are either considering starting the journey or you have been in it for a while with no success. And, some of us just need a little bit of motivation every now and again. So back to you, Manju. Just tell me a little bit about how you approached the studying for part 1, just briefly, and how you got through it.
Sure. For part 1, my first attempt, I just gave it a go. Like I didn't take any course. Then after that, I really worked hard. It's you have to work hard. It's not easy, and gathered lots of study materials. And the second attempt, I passed my part 1 in 2023 September. Then I didn't have any idea what to do next.
Yeah.
I used to always ask Shahana what to do next.
Yeah, so I'll just interrupt you. Manju and I know each other because we both worked at Griffith University together. So because we were not registered in Australia and we both needed to do the exams, we work in preclinical teaching, which basically means not in any situation that involves live patients. And that is how Manju and I know each other. We worked together for a few years there. So, we were all in various stages of the exam and just helping each other, guiding each other along. So tell me, when you decided to do your part 2 and what motivated you?
Yeah. My first motivation is, of course, Dr. Shahana. As she said, we were working together, and I used to see her. She's a very hardworking person, and she motivates us very much. And as soon as she passed her part 2, and I was behind her, I used to always ask her, how did you do it? How to start? What to do? And she used to always say, chill. I'm starting a course which is called Aurora Academy.
Yeah.
And she's preparing the videos and stuff. And I just waited for her to finish doing all the videos. And as soon as she done with that, and I think I should have been one of the first few candidates buying your course.
Absolutely.
Yeah, then I just bought the entire course. Then I started watching them. The OSCEs, skilled OSCEs, and the technical videos are beautiful. The clarity is very good. And when I started practicing at home, especially when I get stuck.
Yeah, so speaking of getting stuck, so what we decided, because we were all, moms and we couldn't travel, to other cities to do courses for weeks and weeks at a time. We had to be here, we had to be at home, we had children. So what I decided to do, and, was a struggle that we all shared, we couldn't go away. So we needed to find a way to have this kind of mentorship at home in the hours that we had free, which was very minimal anyway.
Yeah.
What I wished I could have is videos available whenever I needed them, on a platform whenever I needed them, to play and rewind and etc. So that's kind of when, I decided to start Aurora Academy and make those videos that I wished I'd had during my preparation. So when Manju asked me to, make some videos that she could access, it was a great idea. And yeah, I did.
Yeah.
So tell us a little bit about how you used, the videos, for example, for the technical, and then how you use the videos for the OSCE.
Sure. For the technicals, when I'm practicing at home, if I get stuck with any tasks or any procedures, I used to keep playing your videos, keep watching it, and the videos are so clear and very precise to the point, and it was so helpful. Then I just watch the video, then correct my work, and rewind. keep going back and checking until I get to that perfection level. And moreover, the skilled OSCE, that's the best one. It's so clear with every step she explains is very good. Yeah.
Thank you, Manju.
Yeah.
A lot of hard work went into it.
Yes,
You mentioned. Okay, so a little bit back to you and your exam.
Sure.
Okay, so for your part 2, let's start with which set did you have, for example, in the OSCE?
Sure. Mine was like a combination of weight set and breath set. And one of the new cases, the third opinion case was there as well. So I was very well prepared.
Yeah.
And with your OSCE, the videos as well, I used to keep on listening to those role plays and stuff, even while cooking.
Yeah.
My earplugs are always on, cooking, cleaning. I used to keep on listening.
I get people saying that a lot, that your voice is playing in the background.
Yeah, when I'm driving to my work, I play Shahana's OSCEs, and my son used to say, who is this? This doctor is always talking about it, and you're always on this, even when you're driving. So I was so much always listening to the OSCEs so that I know how to approach when any questions are asked. So that really helped me.
I'm glad. So tell us, Manju, is it possible to get through this exam without hard work? Can you get lucky?
No, there's no role of luck until you've worked hard. If you've really worked hard and if you know all the tasks in depth, the concept of it, especially the OSCEs, you can't memorize it. You have to understand in exact scenario, in the clinical situation, what the patient's expectations are, what the patient's question will be, and how you can handle it. So that all comes with the practice, and for that you should you should understand the cases in depth, and from your point of view, when I listen to your OSCEs, the videos, the way you explain it, you match with the clinical aspect, the clinical scenario, that really helps.
It does. I mean, I always tell candidates and friends and whoever's doing it that this exam is a clinical exam. So if you are, listening to someone who's approaching things from an academic perspective, you're not going to pass. Okay, so you don't need, for OSCE, for example, you don't need to be reading textbook upon textbook upon textbook. The knowledge base that you need to have around the cases is very simple. It's very minimal. What you need to do is be clinical, talk to the patient like a person, address their concerns. It's patient-centered care. That's what we're looking for. And a lot of mentors, unfortunately, because they're not clinical in Australia themselves, don't understand this. This is not a theory exam. It's a very clinically based exam, and find mentorship that emphasizes clinical approach to everything that you're doing. Okay, so tell us, what's the OSCE? What tips can you give people? Apart from, it's clinical, what tips can you give them about studying, how to approach studying, and also, how you were asked questions in the OSCE, just how to approach preparation?
Sure. So you have to not follow any prepared notes or something given by any mentors. So what I did was, when I listened to Dr. Shahana's OSCE course, the way she explains, I write the words in how I can talk to the patient in a much more simpler way. When the examiner asks any questions, so it should be natural. It shouldn't be scripted. So I prepared my own notes, but following Dr. Shahana's, the way she gave us an idea, her idea, but my own.
Yeah, so it's like a difference, for example. That's it. I like to give you a blueprint of how to approach the case. And I'll give you the facts and the knowledge base involved. But the blueprint of how to approach it is, people ask regularly, can you tell us exactly what words to use so we can memorize to say this? I refuse to do that. It's something Manju knows. I don't do that because that encourages you to do the wrong thing. And I'm not doing you a service by doing that. And no mentor is doing you a service by giving you scripted words. So I refuse to do that on principle. But what I'll do is give you a blueprint. I'll tell you, look, You need to introduce yourself to the patient, and you need to ask the patient how they are, and you need to establish a connection with the patient if they share a bit of information with you. So, for example, yeah, so if a patient tells you, I was really, really sick and I came in, and I'm a bit late because I came in, I was really sick. If a person tells you that in real life, if Manju came in here today and told me that she was sick and she's sorry she's late, I'll be like, I'm so sorry. You should have told me. We could have rearranged it. We could have done it at another time. Are you feeling okay now? Would you like something to drink? It's natural. It's normal. You don't have to be over dramatic and exaggerate that sort of thing. So just back to the fact that you will get a blueprint that will make you a better clinician. And that's what we're trying to do, because after exams, and you will get through it. I always used to tell Manju, the only people who don't complete ADC, who don't eventually pass ADC are who? The ones who give up, right?
Definitely, yes.
They're the ones who give up. Those are the only people. And yes, you may give up after 1 try, 2 tries, 3 tries sometimes.
Yes.
But every time Manju told me, you know what, I'm looking for something else to do. I'm not doing this anymore. What did I tell you?
No, keep working hard. You'll be able to do it. Just keep focused. Just focus on what you're doing. Yeah, keep working towards it and you'll definitely do it. And she's my, she's my, and now, I don't know how to explain, a model for ADC. I just followed her footsteps, whatever. She was very hardworking. I just followed and did the part 1 and part 2 as well. Without her videos, it would have been very difficult for me.
Thank you. And Manju is very gracious and very kind. But, just to draw on what she has said, though, hard work and persistence are the only way that you're going to get through this exam. So, a lot of people tell me, oh, Dr. Shana, just in case I don't pass exams, what else can I do? What else can I do? I'm thinking of something else to do. I'm just going to tell you now that if you're going to get through ADC exams, there needs to be no plan B, unfortunately. If you're giving yourself a plan B and you have 1 foot out the door, you're never going to get there, because that's not the kind of determination and motivation and ability that's going to get you to the end of this line. Because yes, it's very hard.
And moreover, it's very expensive as well. When you're very money into it. Yeah. So you have to work hard. You have to be very consistent.
Absolutely.
What you have to
Absolutely. Yeah. But if you want it badly enough, and if you can't see yourself doing anything else but this, then don't allow yourself the plan B. Just simply don't. If you need to do it once, if you need to do it twice, if you need to do it 3 times, just do it. Just get there. And you will if you persist. Just don't give up. So it just depends on you and how much you have inside of you to keep going. And if you decide that, look, this is not worth it for me and I'm going to exit at 2nd attempt, that's okay too. As long as you've accepted that you are the one making the choice to give up. Because if you didn't give up, you continue, eventually you will get through it. It's just that simple.
That's right. No, that's right. Yeah, I completely accept what you said. Yeah, you have to keep doing it. And one day you will get through it.
Yeah, yes. So stick around with us. What we're going to do is we are going to have a little bit of a Zoom session for all our members and anyone else who needs to join. And, we'll advertise that for you with plenty of notice and send over links. And Manju is going to be kind enough to go into the details of, the OSCEs and the exam itself. But, that will take a little bit of time. So we'll do that on a Zoom. We'll invite all of you. And of course, it will be free and whoever wants to join can join. And we'll, have the details in a link somewhere around this video. And we'll see you guys on a Zoom. So I'll thank Manju for joining us, and I'll let you give them one last parting piece of advice.
Thank you so much, Shahana, for giving me this opportunity. I know how difficult the ADC journey is, and this the opportunity what Shahana has given me helps even the other candidates to understand this journey is hard, but with consistency and hard work, and moreover, hard work, you can't just keep simply working hard without knowing what's the base, what's the concept of it. That's the most important thing. Yeah. You have to work hard in the proper way.
And work smart.
That's right. Well said. Yeah, we have to work smart, and you should know how to approach the exam And so, as I said, Dr. Shahana's Arora Academy really, really helped me. So just like, keep doing it. So one day you will definitely achieve it.
Thank you. Thank you so much. Thank you to all of you for watching. And thank you to Dr. Manju, and congratulations. I guess I was so happy. One of the best days that I've had recently is when Manju messaged to let me know that she had passed. I'm very emotional because, she, much like everybody out there, much like myself, Manju's been through a lot. And, getting to the end of this journey was very emotional for all of us. So congratulations.
Thank you. And
Thank you.
Thank you.